My name is Frankie Robertson, and my firm is the Amandla Group. And we're such a complement to the Go Far efforts because my role with the organization is making sure that the Amandla Group is addressing the needs of Black and Brown birthing people through policy, through direct project management services, direct advocacy, and research. So for the Amandla Group, we spend a lot of time at the Capitol. The Capitol is the people's house, as I call it, and it's our rightful place to be there. So through my work as a direct lobbyist, I spend time lobbying policymakers on issues that impact our overall health, not just things that seem like the obvious, like is there access to care for Black and Brown birthing people? Things that may be very obvious, but some of the not so obvious things that impact our life course, like income inequities, the social determinants of health, and the myriad of things that fall underneath that umbrella that have to be addressed that impact us far beyond our pregnancies and well before a pregnancy. So I spend time at the Capitol making sure that there are laws that are fair and just, that provide equitable opportunities for us to live healthy, fruitful lives and achieve the dreams that we have for our family and for ourselves. But then I also uplift the voices of people who have lived experiences through qualitative research and connect the outcomes of that data to policymakers and speak the language that they understand so that we can drive results. I'm also a doula, and that's one of my proudest accomplishments. I've trained as a doula, and through my doula firm, I provide services to a really small group of clients throughout the year because I really, really love birth work, and I want to provide that support to birthing people, sometimes that I feel like I didn't have for myself. And because my background is in maternal health, because I absolutely love us, and I love birth work, I love everything about pregnancy and the postpartum period and childbirth and healthy pregnancies, that I constantly want to make sure that I'm in a position to give back and be a part of that day-to-day work, because I think it's fascinating and it's amazing in every way. So I started the Amandla Group in 2020 after working in the maternal child health field for about 15 years. And my goal with the Amandla Group was to start a firm that would work to directly address the health disparities and inequities that disproportionately impact Black and Brown birthing people directly through policy change, through project management support for other organizations, through advocacy, and through research. What I saw was the need to be able to have a mechanism by which I could tell my story and uplift the stories of other Black and Brown birthing people who had a story to share about their lived experiences, whether it's throughout the birthing journey, the postpartum part of the birthing journey, or just overall life course and how it impacts our birthing journey one day. And I wanted to be able to speak directly to Black and Brown birthing people about some of the risk factors involved with giving birth while Black. And just to be able to explain some of those challenges in regular everyday terms and ways that we experience them, and not speaking through data and numbers as if we're statistics, because we're not, we're people. Frankie Robertson, the Amandla Group, Go Far, Louisiana.